Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, M.D., New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. We hope you're all warm and cozy out there. It is really cold and the snow's coming, right, John?
That's what I'm hearing. I'm hearing it's going to be a little bit of a storm today, so stay inside if you can and certainly keep warm.
Oh, come on, help me shovel. I need some help shoveling. Please come over to my place and bring a shovel. Even I'll give you a shovel.
We'll talk about it after the show, Doc.
And I'll make you some chicken soup. We have John Taransky here. Coop is on the controls. And here's Aaron. So everyone is in place. We're ready to take your calls. We're live. And you can pinch me if you want to find out that I'm really alive.
Yeah, that's
here.
right. So if you have any questions for the doc, give him a call, 1-800-848-WABC Radio.
So I have a lot of interesting things to talk about. I think almost too much interesting to talk about. I was at national cancer meetings this week for prostate cancer, and I'm going to talk about prostate in a little bit, but there's a lot of new data and interesting data and economic data and medical data that I think every man and their loved ones should know about. So you can call me later about it, or I'll try to get to that within the show. I have several patients I want to talk about because the patients are so striking. And remember a few weeks ago I told you about a woman who was a best friend of one of my very dear friends. 50-year-old woman had melanoma. She brought me to the hospital where she was staying somewhere else, and they decided when she came to the hospital they weren't going to offer any treatment, that her prognosis was too bad. The doctors got together. They started to hang crepe, as they say in medical parlance. Hang crepe means that the doctors put up all this crepe and say, oh, it's so terrible, it's so bad. And she went from walking in the hospital to being comatose, thrashing about, not knowing day from night.
Yeah.
Under no treatment. I was brought in on Sunday night. They said, what can you do, Doc? And the next morning they were having the meeting to put her in hospice, which is terminal care.
Sure, I remember the story, Doc.
So you remember the story. I told you the story because it was so shocking to me. So I got a call last night, and guess what? How's our patient doing?
I'm hoping better than she was.
Yeah, she's walking and talking.
I figured you were going to tell me that, Doctor.
We started radiation, and she's walking and talking and has made a substantial recovery, even though for 4 or 5 weeks she was totally untended.
Yeah, unreal.
So there is hope. There's always hope. As long as the patient is there and the patient and family want some treatment and give a chance to the patients, there's a hope. And you don't have to say, okay, just because one doctor says go on hospice, to go on hospice. We had another patient this summer that had terrible skin cancers on each cheek the size almost of a fist. It was unbelievable. And she was one of the big hospice hospitals. And a dermatologist, he knows about my work, called me up and says, Gil, can you do something for this woman? This was last May.
Yeah, sure.
And she came from the hospice. Hospice means by definition you've got 6 months to live at last, and it's just terminal care. They give you pain medicines. And there's nothing wrong with hospice. Some people do need hospice, and that's the best treatment. But it's not for everybody. And we always tell patients, get a second opinion.
Sure.
But get a fresh second opinion. Don't go to your first doctor and say, oh, Dr. Lederman says this, because the other doctor would say, oh, yeah, I know about that, but blah, blah, blah. We don't want to hear blah, blah, blah. The patient should come in, and they should get a fresh second opinion from a different person with a different perspective. Is there something to do?
Sure, a new, fresh second opinion.
Well, new, fresh. After a while, it starts to be stale, so you want a fresh second opinion to look at it in a different way, a doctor who has different experiences. And one thing I don't actually tell my patients very much, but I am triple board certified. I'm trained in internal medicine, medical oncology, which is chemo and cancer, and radiation oncology.
Right.
And there's almost nobody else in New York that is triple board certified and is practicing radiation oncologist. And you have a different perspective. Your background gives you a different perspective. So everyone comes with their own perspective. And for patients in their lives and their loved ones, it really matters to get a fresh second opinion sometimes. Yeah. This woman woke up. She's talking and walking. 4 weeks ago, she was being sent to hospice. She was comatose. So, yes, a second opinion can make a difference. Is it guaranteed? No. Is there a chance? Yes.
Yeah.
And so, though this woman, the woman that took me to this patient, now has a mother, and the mother has lymphoma. So she's been treated with chemo, and she had a lymphoma, a non-Hodgkin's lymphoma in the chest. It was a isolated lesion. Okay, so one area.
Right.
And the woman asked me about it incidentally, and I said, look, I mean, a localized lymphoma that's large in size is usually not that well controlled with chemotherapy. Usually chemo fails. It may work initially because lymphomas are very responsive, but after a while, when you have a bulky lymphoma, they often fail because chemotherapy can't eradicate all the lymphoma cells. So I felt very strongly that she should have had radiosurgery. Obviously, we're the fathers, grandfathers, and pioneers of radiosurgery in America and the Western Hemisphere. But then the doctor back then was saying, chemo, sabi.
Well, it seems like a broken record player, Doc.
It seemed like a broken record. And then you have the patient torn between one opinion and another opinion, which are diametrically opposite.
Yep.
So what happened? Well, the woman's cancer spread to the brain last summer. And the same doctor, and of course they want to trust their doctor. Everyone wants to trust a doctor, and that's a good idea. Like Ronald Reagan said, trust but verify.
Sure.
Right? Get a second opinion. See if that's right or wrong.
Right.
What do you have to lose? 1 hour of your life? 2 hours of your life? Are you going to be embarrassed? I don't think so. So the cancer spread to the brain. What did the doctor say? Chemo, sabi. So she got chemo last summer, and it's worked a little bit, and then it came back. And what did he say again?
I'm going to guess chemo.
Yeah, chemo. And what happened to the cancer? Well, now the cancer is growing despite chemotherapy. She had methotrexate, which caused her to have kidney problems. She had other chemo, which caused her to have other problems. And the biggest problem is that the cancer is growing in the brain. The doctor got an MRI on Tuesday. The doctor didn't tell the family until Friday night. She may die this weekend. It's pushing on the brainstem. She may die this weekend. Get ready for anything this weekend. Well, what does my associate, colleague, whatever, woman, acquaintance say? She calls me up last night at 8 o'clock crying, the doctor says my mother could die any minute.
Yeah.
And she obviously loves her mother and she does love her mother, does anything she can for the mother. But for a layperson, it's often very confusing. Do you believe Dr. X or do you believe Dr. Y? And how do you
distinguish the difference?
How do you distinguish the difference? How do you determine the difference?
Sure.
Well, when Dr. X tells you you're going to die this weekend, well, that kind of pushes you in the hands of the next doctor, right?
Of course.
So we got the report last night. It was Friday night at midnight, and it's one area of tumor, and the tumor is lymphoma. So it's, again, very sensitive to radiosurgery. And most